webinar in our new series, One Stop for Health and Nutrition. I'm Kim McCoy-Wade, and after a brief introduction, we're going to cover 4 topics today. First, we're going to talk about the huge opportunity that the Affordable Care Act and the healthcare expansion presents to finally turn around CalFresh participation rates in California. Second, we're going to talk about how you can maximize that opportunity in your county with some new tools and new data and new strategies. 3, we're going to hear from advocates in 4 counties, San Diego, Los Angeles, San Francisco, and Alameda, who are all partnering with their county in some creative ways to move the needle on CalFresh. And fourth, we'll have time for your questions. If you have questions at any point, feel free to type them into the chat box there, and we will sort them. And like I said, aim to have plenty of time to address as many as we can at the end of the call. So the Alliance, briefly. We are a statewide roundtable of 7 groups whose logos are all there, convened by the California Association of Food Banks, but also including California Food Policy Advocates, Western Center on Law and Poverty, San Francisco Marin Food Bank, LA Food Bank, Catholic Charities of California, and the California Family Resource Association. We all came together around the table in 2011 with a bold goal of transforming CalFresh participation in 5 years by 2016. And over time, we've developed an approach that is data-driven, that is focused on the consumer, that is committed to a statewide-ness. By that I mean that we have the same excellent experience for our consumers in every corner of the state. And we seek alignment with our counties, with our state partners, with our federal partners, and with each other wherever possible. As I mentioned, we set a bold goal of getting to the national average, 75% of all eligibles for SNAP or CalFresh in California. We want to be participating by 2016. We identified 3 strategies to get there, and this call is going to focus on the first one. We're going to have separate webinars later this year on each of the other, but just to lay them all out, the 3 strategies we think that will get us there are, number 1, maximize the Affordable Care Act in dual enroll families, now that most low-income families are eligible for both Medi-Cal and CalFresh. Number 2, reduce churn, which is when eligible people come off of CalFresh for a procedural reason, only to come back on in 90 days or so. We want to keep people on who are eligible and not be churning people because of paperwork. And again, shared goal of both the counties, the state, and advocates. And strategy 3, something we've seen in a few counties in California and certainly in several western states, delivering same-day service to the majority of folks so that they get the food they need when they need it and aren't left waiting or discouraged and in hunger. But again, today's call can be boiled down to a question I heard when I was out in the community a few months ago talking about this. I believe it was the executive director of the food bank in Santa Clara said to me, how can California be the best at signing people up for health coverage and the worst at signing those same people up for food assistance? These are families who are eligible for both now, thanks to the Affordable Care Act, working with their counties on both, thanks to the Affordable Care Act. So this is the nut of the question that we're going to try to answer today. And the good news is there are lots of strategies to get us to be the best at both. What's the opportunity? Well, quite simply, Medi-Cal expanded up to 138 for all people in January. So now we really do have an incredible alignment of income eligibility, whether you're a child, whether you're an adult. We do have the SSI cash out issue, but whether you're a senior, again, this Medi-Cal and CalFresh are 2 of the largest supports for people, and most low-income families should get them both. But it's not just the eligibility, it's also the customer service revolution the counties have been driving. So if for example, their call center networks now roll to each other. They've done a lot to really modernize and transform their service for Medi-Cal. That should also impact CalFresh. And then, of course, I don't have to tell you all, there's a huge effort to reach these families. Covered California has invested in community grants, in billboards, in television and radio, more outreach, promotion, application assistance. And again, we want that not to be talking to families just about health or just about food, but about both supports they need. Why do we want to do it in one stop? I think everyone on this call knows, but just briefly to run through it, less red tape, right? This is to tell your story once. Not go to this store over here for health, go to this store for food and tell us your income, your family size, everything all over again. We know if families have an integrated experience, they're more likely to get both and keep both, rather than come here for this interview and come here for this report. Again, we all know that participating in these programs brings more federal dollars, whether it's the CalFresh dollars spent in the grocery store, or the Medi-Cal reimbursement at the local clinic. That's where we want people to be getting their services and relieving pressure on the local charities, many of whom are on this call. And, of course, for the counties, this is less work if they can handle one family in a comprehensive way. Of course, it requires re-engineering, retraining to integrate these things. Some counties have been doing that, some hadn't. But there is a huge opportunity for the counties as they continue this self-proclaimed revolution to do things more efficiently. And there's two bullets under there that we'll talk about in more detail. But one opportunity is Express Lane, where they can, rather than do the full CalFresh eligibility determination, the full Medi-Cal eligibility determination, they can do CalFresh, ask if you want health, and then go right to plan selection and enroll them. That's a wonderful waiver that California is participating in, and we'll talk about that more. And as of the state budget, which I believe was signed, was it Thursday morning, we now have a much higher gross income eligibility test for CalFresh, 200%. So we hope to see more working people coming in the door with those high expenses. We know they're coming in for health care, whether it's Medi-Cal or subsidies, but we can serve those working families with greater gross income tests for CalFresh and the greater health supports as well. And finally, of course, families who have health and food are less likely to have a crisis, be it emergency rooms and other emergency services. So lots and lots of reasons. Okay. That's a huge opportunity. What do we think are the opportunities for you in your county and how you can leverage this? The main thing that we think, given the ACA opportunity and the new data that we're going to share with you, is you can work with your county to really set measurable goals, achievable goals, to increase participation in both programs. So we see many people looking at their Medi-Cal rolls and saying, wow, those folks look eligible for CalFresh too. Let's go get them. And make sure they know about it, make sure they've been offered and assisted to sign up. So you could say, we want to get a percentage of our Medi-Cal on CalFresh. You could say we want to get a number. You can also do it in reverse. We'll talk about the data in a second. You could set a goal that says, how many people we have on CalFresh do we want to be sure they're on Medi-Cal because it looks to us like they're income eligible? And with all of this, you're driving to a numerical goal on your CalFresh rolls. How many people do we have on CalFresh? How many do we think are missing? How many can we get by looking at the Medi-Cal rolls? All of these are ways that your county can frame a goal based in the data, based in current program opportunities, to increase service by CalFresh in your county. So how would you get there once you have a goal? You would work on some of these strategies. And the three big ones that we're seeing, and we're going to hear more about from other county advocates, is first at intake. You want to be sure that families are coming in the door and getting intake. And by door, I don't just mean walking in the office, but on the phone and through the web portals, getting both of those in one stop. And counties are working to train and re-engineer to do that. But that's the most ideal place is to catch people when they first come in and get them with both programs that they need. And we're not talking about CalWorks on this call in particular, but of course, if they also have children, you'd want to screen them for CalWorks and other programs that the county might offer. But the focus of this call is CalFresh and Medi-Cal. A second strategy where we're seeing so much happening is the inReach. I love this new word after years of working on outreach, inReach. Counties look at their Medi-Cal enrollees, look at who should be income eligible for CalFresh, and contact them, assist them to sign up, and again, vice versa. And we're also going to hear about counties who are looking not just at their Medi-Cal list, but their school meals, so some huge partnership with their school systems, and WIC, which is often a partnership with public health or other local WIC provider. So we'll hear about that later in the call. And then the third strategy, which may be the most directly impacting those of you on the call right now, is outreach. Again, we would like you all who are doing CalFresh outreach or Covered California outreach to be able to help families with both their health and nutrition needs. And so there are groups out there who are looking at that, both some counties who are releasing RFPs on that, and California Endowment looking to fund some of that. So that's something definitely to be exploring as well. And finally, I'll just say that some of you may remember a couple years ago, the legislature, as part of its oversight of CalFresh, asked the Department of Social Services for its plan to increase participation. And so, of course, the department asked its counties for their plans. And so about 2 and a half ago, we got 58 county plans, and they're all posted, and we're happy to share those with you if you haven't found them yet. But the point is now the Affordable Care Act is up. This data is coming that we'll talk about. And so it's time to update the plans. And so that's something you can also work on with your county is how do we use the new data, use the new strategies, and update our plans. So let's get specific about the data. First, let me talk about eligibility. Who's eligible? And thanks to this graph, what we're looking at is that big circle in the middle that's the dark, dark purple. You can see almost everybody eligible for CalFresh should get Medi-Cal. That's not, I tend to be conservative and say more than 90%, but some people say as high as 95, 96, but let me just say your first digit should be a 9. Most people on CalFresh should be on Medi-Cal. Second is the reverse. It looks to be about 2/3 of the folks on Medi-Cal should be eligible for CalFresh too. So that, again, the majority of low-income families should be getting both, and that's the dominant data point, the eligibility driver that you should be focused on, is that that's what the world looks like for families, that most of them are in that center. How can we help them get both? I do want to caveat just again that this is about people 65 and under. Medicare is a whole different health world, and we hope to be providing some information about that going forward. But really, this is about under 65 for now. Okay, so once you know the eligibility goal, the next thing you want to look at is, well, how are we doing at my county and enrolling? Are we anywhere near these goals? And you know what? Thanks to CDSS and their new data dashboard, we can begin to tell. So what you have here is a screenshot of the new data dashboard with the most recent data, October to December 2013. And I'm going to talk in a second about the caveats because obviously that's before ACA was implemented in January 2014. But nonetheless, this is the most recent data we have. And I went to that light blue bar and chose statewide. And you can see, we know statewide the percent of people on Medi-Cal receiving CalFresh in the current quarter, go over to your third column, 65%. The number of CalFresh persons receiving Medi-Cal, 3,157,018. And the percent of CalFresh persons receiving Medi-Cal, 72.8%. That's what it looked like in the state before Affordable Care Act. And if you go to the data dashboard on this call or after the call and go to that light blue box where I chose statewide and chose your county, you can see your county's rates. And if you want, you can do a side-by-side of statewide and your county. So you can see how you guys looked in October, December 2013. There is, as you can probably tell, a ton more data in the dashboard. The two top lines, of course, is what we're all driving toward, the number of people on CalFresh and the number of households and persons, so cases and individuals. And you can see that number just tracking up, which, again, among eligibles, which is a good thing in this economy and given the need out there. And we're going to be, all of these sub-strategies are about getting that number up to where we want it to be. And just to preview again, you see below in the dashboard some indicators about timeliness, about errors, and about churn. And so those are all things we'll return to on a future call. All right, now, context matters a lot. I would not want anyone to take the number off the dashboard. Your next step should definitely be, let me put it this way, to go talk to your county. And first of all, they're going to update it for you. They know exactly how many people have been coming on Medi-Cal very closely. And so you really want to make sure you have the best data with your local folks about the current situation. Additionally, as you may have read in the papers, not all the Medi-Cal cases are easily going into all the databases. There's a lot of pending issues. So the county may actually have, and in fact I'm sure, has better data on the Medi-Cal app than the state at this point. So CDSS, of course, the dashboard's only as good as the data from Medi-Cal and from the county. So your county really does have the best data. And I just want to say it's super important to know, I don't think anyone expects dual enrollment rates to hit dual eligibility goals January 1st, 2014. This is the biggest change in social services in at least 20 years, probably since welfare reform. So we do think that it's quite possible that the first quarter in 2014, you will watch the Medi-Cal numbers skyrocket in your county, which is great. And CalFresh may not keep up at first because a lot was happening. A lot were coming in through the Covered California portals, which aren't as connected to CalFresh. So I'm not too bent out of shape about what might happen in the first quarter, although obviously every week that someone who's not on CalFresh who could get it is very, very important. But for this purpose, what you want to be talking to your county about is where are we now in the first quarter, where are we second quarter, where are we third quarter, where are we fourth quarter, what's the trend line? How are we going to get to those full enrollment goals so our enrollment numbers reach the eligibility numbers? How are we going to get there given all of this change? So here's what I think and what I hear is happening in counties around the state. Advocates are working with their counties to set a specific goal. Look at where you are and look at where you could be with maximum dual enrollment in both programs. You could use the center. CBTP is my shorthand. They were the source of that Venn diagram of those two circles. You could just straight adopt those rates, more than 6 and more than 9 and 10. Or you'll hear from other counties, you could actually do the math and look at your numbers and say, we think there's X number of people to go find and assist with. Either way, you want a goal that you can track your progress against. Pick your strategies. InReach may be the place to go. Express Lane may be the place to go. Integrated outreach. There's actually a number of ways to get there. Make sure cross-training is happening. But the point is to have some strategies. And then, of course, 3, keep looking at that data and seeing where it's working and where you need to do some follow-up. Now, of course, this is, again, the Alliance approach is statewide-ness. It's not up to each county to figure this out. There's also state and federal things that are needed. And let me just briefly give you an update on what the Alliance is working on. So first and foremost, we're tracking this data, and we are very grateful and supportive of what CDSS and CWDA did to build this dashboard. It's the first time we've had this kind of real-time or close to real-time window into what's happening with participation for consumers. A second thing we're working on, many of you know this issue, Covered California built a brand new door to healthcare, and it currently allows people to check and say, yes, I would like a referral to CalFresh, and then that gets sent to counties in an e-hit, and then counties can follow up in a range of different ways. Everybody would like to see that not be a referral, but an actual integrated application. So when you finish your online Covered California, you click a button, and you go right to the county's online app that already knows what you know, what told them from health, whether it's a simplified food app or a pre-populated app, but some solution that allows you to stay online, one stop, not till things again, and finish that food and cash application. So that is a decision before the Exchange Board, the California Health Exchange Board, before August. So we will be coming to you guys soon with when that proposal is shared to support it, hopefully, and ask for changes if needed. Express Lane, many of you know Phase 1 rolled out in February with letters went out to people who are currently on CalFresh and said, hey, we can sign you up by Medi-Cal in one step. 214,000 people across the state as of last week said yes, both in February and March, which was great. But now it's time for Phase 2, which is anybody who walks in the door and applies for CalFresh now should be offered that same Express Lane. And so we're working very closely with DHCS, CDSS, and CWDA to see if that's happening, if counties are really maximizing that as a way to skip a step, not have to do full eligibility determination for Medi-Cal. So that's a work in progress. Of course, you say, what about reverse Express Lane, which is people who are already on Medi-Cal? Can we just check a box for them and get them on CalFresh? And CDSS has heard that input and has a proposal to USDA pending. It's uphill because, remember those circles? The overlap from Medi-Cal to CalFresh is only about 2/3. But there's many elements of it that could be approved standalone or certainly are worth pursuing, especially things around the interview, which only CalFresh requires, and verification, which CalFresh requires a few more and a few different. Many of you also know that reporting is just as important. We don't just want to align the intake and people come on. We also ideally would have the reporting be integrated, and Western Center and CFPA have taken the lead on a bill to do that that's moving through the legislature, which we're very optimistic about. And finally, I can't not say that as much as we are supporting and working with the state and the county to achieve this goal, there also are just ongoing differences between the programs that need to be untangled, simplified, aligned, and we continue to advocate for that. I've already mentioned the verifications, the interview, and the telephonic signature for CalFresh remains, to me, an anachronism. We don't require it for Medi-Cal. Why do we require it for CalFresh? Things like that need to get knocked out so that we can better serve people. So that is still what the Alliance is working on with our state partners in Sacramento and in D.C. to help make the integration on the front line for the consumers possible. But again, back to the counties and what you can do. I want to turn now to our third section. Now that we've gone over the opportunity and gone over how you can maximize it, we want to get real specific about Toolkit and some stories. So we have built a web page, onestophealthnutrition.org, that has everything I've talked about and more on here, including the ACA Opportunity for CalFresh, a fact sheet, County Leaders in CalFresh, 3 steps, which really talks about the whole strategy to boost participation, with ACA being one of the strategies, churn and same-day service 2 other ones. The data dashboard will be updated at least quarterly. We're very lucky to have a how-to-use dashboard guide from a volunteer at San Francisco Marin Food Bank to just, the first time you see it, have your drink of beverage of choice with you, because it does require some concentration and some time to unpack all these numbers. But boy, once you figure it out, it is a gold mine. So you might want to start with the guide to kind of dig around, see what numbers are up there. I'm going to write a blog to kind of update people on things as they happen when new data comes out, new reports come out, and then just so you can find everything, we just built a page at the very end that includes kind of everything, so you can just in one stop find it. But some people have already gotten started before we even have the toolkit ready, and that's who I want you to hear from next. Today we're going to hear from advocates working in 4 counties on this issue. We're going to hear from Allison Pratt at Alameda County Community Food Bank, Yolanda Anguiano and Alexis Fernandez at CFPA, LA office, Terry Oley at the SF Marin Food Bank, and Amanda Schultz from San Diego Hunger Coalition. At the end of that, we will take questions, so please do continue to send those in as you have them. And Allison, take it away.
Hi, can you hear me, Kim? Hello?
Yes, I can. Yes,
okay,
I can.
Okay, awesome. Great. So I am Allison Pratt. I am the Director of Policy and Services at the Alameda County Community Food Bank, and Kim has invited me on to tell a little bit about the work that we're doing in Alameda County, so I'm glad to do that. I want to start by talking about the work that we are doing around setting goals with our county for CalFresh participation. And we have a longstanding and close relationship with Alameda County Social Services Agency. We know that the leadership there has a strong desire to increase CalFresh participation. And we also know that there is really great political support for improving our participation rate, that members of our county board of supervisors are asking for a goal to be set. So this is all great and presents the perfect opportunity for us as advocates to start this conversation with our county about using the data that we're now getting to set some meaningful and achievable participation goals. We also know that our county is really eager to maximize dual enrollment. We are one of the counties that has issued that combined RFP for CBOs to do outreach around CalFresh and Medi-Cal together. They are putting systems in place and cross-training workers to help ensure that everyone who's enrolled in Medi-Cal, as the program continues to expand, is also enrolled in CalFresh, if they're eligible, and likely they are. So the place where we're naturally arriving is to set a goal around dual enrollment, a goal to be where we know we should be given what we know about the percentage of Medi-Cal households who also qualify for CalFresh. We are particularly excited right now that some venues have cropped up to really incubate our ideas around goal setting and to build community support. Specifically, our county supervisor, Wilma Chan, has declared a new war on poverty, and one of the 3 issue areas that she's identified is food insecurity. She's convened a work group to work on this, and our deputy agency director at SSA attends these meetings, and she and I have talked about bringing our ideas around participation goals to this work group to generate input and support. I think it's also important to note that the county has a legislative advocate that participates in the work group, that there are other county departments and agencies, and all of this is to really emphasize that the county as a whole, with SSA as the lead, is really taking an active role in increasing CalFresh participation in our county. Concurrently with this discussion on goals, we wanted to shift our outreach strategies to pursue higher levels of dual enrollment. And so this led us to pursue an in-reach strategy. Backing up a little bit, the food bank has an 11-year history of doing outreach and application assistance for CalFresh. We've done all types of things, from passing out flyers at health fairs to multilingual radio campaigns, and for our in-reach strategy, which we embarked on about a year ago, we partnered with our social services agency to design and send a mailer to every Alameda County household that was enrolled in Medi-Cal but not enrolled in CalFresh. And at that time, this was about 58,000 pieces of mail. We worked with a communications consultant, whom we've been working with for a very long time as well, to apply the messaging that we know works and to give people options for how to respond. And we were told by the mail house that we use that a really good return rate for direct mail is about 2%, and we wound up with around a 4% return rate. 2,300 people sent us reply cards by mail. Many more called on the phone. The number of applications that we submitted during this time really skyrocketed, and about 90% of those applications wound up being approved. Looking ahead, we're going to be doing more in-reach, and we're going to be doing this via direct mail again. And in our current campaign, which will again be focused on those households that are receiving Medi-Cal but not CalFresh, we are sending out 80,000 pieces of mail. And we will also be targeting WIC households, or households that are aging out of the WIC program, and that's about 10,000 pieces of mail. So we've got about 90,000 pieces of mail that will be going out over the summer. This mailing will be dropped in batches to kind of better control the flow of responses for our staff. And I just want to say that overall we have found this strategy to be very cost-effective compared to other large campaigns that we've done, because it is so very well targeted. I also want to say that even if you don't have the resources for a direct mail campaign, there are many other ways to reach this specific population. For example, our county was able to map the population and tell us exactly where they are in terms of census tract and neighborhood, and other groups have walked these neighborhoods with flyers, leaving them in businesses or going door to door. But in the future, what we would really love to see is some kind of a simplified form or a pre-populated application for people who are receiving Medi-Cal but not CalFresh. Something where the client would just need to check a few boxes and sign a form to provide that information that we don't already have because they are connected to Medi-Cal, and can we send this to them instead of an informational piece? And we think that that would just yield a really awesome return. We've talked to our county about this, and they love the idea, so now it's just a matter of figuring out what we need to do to make it happen. And I'll stop there.
Thank you, Allison. Let's hear from Yoli and Alexis about Los Angeles.
Good morning. Let's see. The scale and the scope of the dual enrollment opportunity in LA is significant. DPSS, which is LA County's Human Service Agency, has a goal of enrolling 3 million Los Angeles residents into Medi-Cal. Currently, there's 2.1 million residents receiving Medi-Cal. Additionally, over 1 million residents receive CalFresh, and we believe many more are eligible and do not participate. Because of the significant overlap in eligibility between Medi-Cal and CalFresh, DPSS has taken steps to dual enroll applicants who are eligible for both programs. For instance, DPSS eligibility staff are duly trained in both programs. DPSS practices a no wrong door policy, which allows for applicants to seek benefits for any program by visiting any of their 32 district offices or partner CBOs, or by accessing the online application, customer service call center, DPSS mobile office, and also now their mobile app. So by working with a coalition of advocates, Administration for LA Families Coalition, we have identified several priorities to increase CalFresh participation in LA and further the progress DPSS has already made. The first one, enrich to programs with similar eligibility requirements, and then I'll follow that with improving the referral process from CalHere's, Cover California. So let's see. Next slide, please. Enrich in LA County with regards to this, through their electronic data management system, DPSS uploads all applicant information across programs into Leader, enabling eligibility staff to identify individuals who are likely eligible for but not participating in CalFresh. For example, DPSS has established an automated process to send out a mailer to Medi-Cal only recipients without a share of costs to inform them about their potential eligibility for CalFresh and the amounts of benefits they are likely to receive. So this is based on income and household composition in the Medi-Cal case. Next slide. Now, with regards to the CalFresh referral process, LA County has taken steps to identify a consistent process for responding to the electronic referrals received through CalHere's. Ultimately, we like to see DPSS seamlessly initiate a pre-populated application for CalFresh. In the meantime, DPSS has developed an informative CalFresh mailer. Once it's been approved, it will be sent to those individuals who requested a referral to CalFresh. The flyer will tell interested healthcare applicants about the various ways that they can enroll in CalFresh. Next slide. We think a number of opportunities remain to maximize dual enrollment, particularly as the county continues to promote healthcare enrollment. We plan to continue to keep DPSS engaged in order to persuade them to implement additional in-reach strategies and solidify a process for the CalFresh referrals. We've also started a dialogue with the county's Board of Supervisors and hope to encourage their engagement to the opportunity to increase CalFresh participation and maximize the dual enrollment. I'm relieved to know that we all share the common goal to increase CalFresh participation. By we, I mean the Board of Supervisors and DPSS. I mean, our advocacy is necessary to make sure we get there as soon as possible. Thank you.
Thank you, Yoli and Alexis. Terry from San Francisco Marin. Let's hang on one second while we see if we can get her unmuted. Let's see, Amanda, are you there from San Diego?
Hi, yeah, can you hear me?
I sure can. Would you mind jumping ahead and we heard from San Diego in front of San Francisco while we sort out our technical?
Sure, no problem.
All right.
Hi. So my name's Amanda Schultz. I'm the CalFresh Outreach Director with San Diego Hunger Coalition. We're a small nonprofit that works to coordinate a network of about 60 organizations across San Diego County that are actively engaged in CalFresh outreach and application assistance. And we're very happy to have a strong relationship with our San Diego County Health and Human Services agency that implements the program. So Kim asked me to talk about two specific pieces that we've been really happy to work with our county on. The first one that I'll talk about is the implementation of AB 191. And so I know I think because of the quick turnaround time on the implementation of this legislation and passage, there wasn't necessarily a large amount of guidance provided by the state, but we were really excited that San Diego County took a really proactive approach to implementing this legislation, including a special program letter that was released in March that provided specific aid codes for different populations that would be entering into it. Oh, excuse me, you know what? I'm mixing these two up. I need to talk about express enrollment. So San Diego County released program guide materials with specific information about how their workers would be able to implement AB 191 and make sure that anyone who was enrolled in Medi-Cal would be able to, and had the gross income test of 200%, would be able to take advantage of CalFresh if they still met that net income test. Obviously, as Kim said, it's probably going to be outdated, but one thing that we did want to share is that, there are counties that did a really fantastic job of being able to be proactive and moving ahead to implement some of that information and thinking outside of the box about how they could move those steps forward. So the next piece that we also wanted to share about was the express lane enrollment. And so as I was beginning to talk about, San Diego County released a special letter to all of their staff outlining all the 2 different aid codes that they created to be able to express enroll individuals into Medi-Cal from CalFresh. So they treated that question number 3 on the CalFresh application. There's a small checkbox that says, are you interested in receiving Medi-Cal? They treated that checkbox as an opportunity to express and auto-enroll individuals that were eligible for CalFresh into Medi-Cal. So there was just one extra form that individuals would be asked to sign at the point of interview, and then that would allow them to be able to have a Medi-Cal case processed. So I think our county is also on the line if people have specific questions about how that occurred, or we'd also be happy to make that connection.
Thank you, Amanda and San Diego. Is Terry with us now?
Yes. Can you hear me?
Yes.
Can you hear me?
Welcome.
Oh, come on. Oh, good.
Yes. Hear you.
Sorry. Good. Sorry about that. I was like, what's that second little plug for? Now I know. It's for the microphone. So my apologies. So hi, this is Terry Oley from the San Francisco Marin Food Bank, and I oversee policy and advocacy here. And I'm going to talk briefly about our experience here in San Francisco, which has some parallels to the other counties you've heard from. I am the chair of the Food Security Task Force here in San Francisco, which is a supervisor authorized, county supervisor authorized and established task force that comprises the major city agencies that fund and take care of low-income populations in the city, as well as 8 nonprofit organizations that are kind of the major providers of most of the food programs. And we, over the last 1.5 years or so, developed a very robust food security assessment in the city, and with the intent of presenting that to the supervisors and the mayor to ask for additional funding and leadership on addressing the issue of food insecurity in the city. And what came out of that was a very detailed, not only a very detailed assessment of the problems, the issues, the needs, but also the mapping the opportunities that we had. And of course, what rose to the top, no surprise, is that CalFresh has probably remained our biggest opportunity for getting resources into the hands of people who were at risk of food insecurity. And of course, that was an excellent value proposition to make to our city leaders, since the investment that the city has to make is quite minimal compared to the leverage of federal dollars that come in, the economic activity that it stimulates. And we were really excited to be able to talk about all the opportunities. When we talked to the Board of Supervisors and presented to the Board of Supervisors these opportunities, the board, much to our glee, said, well, what do we need to do to really end food insecurity in San Francisco by 2020? And that ended up becoming a full-blown resolution that the county passed, saying that the city is committed to ending food insecurity in San Francisco by 2020. And then, importantly, underneath that banner headline, which we were very excited about, the board said, let's get into the specifics. Let's talk about exactly what needs to happen and where our biggest opportunities are to address this issue. And let's talk about the funding that would be required to truly fill the holes in our current funding. So we, again, because the task force is city and nonprofit organizations, work together, and I actually think that there's some CalFresh county leaders on the line today too, to identify the populations that were the best opportunities for increasing CalFresh participation. And again, not surprisingly, the one that came up first was the Medi-Cal clients. And as you can see from the slide, our HSA determined that there were about 9,000 people that were likely eligible for CalFresh and not on it. And I should say, just by way of context, that in San Francisco we have about, we don't have the numbers that LA has. When I heard those millions, I kind of dropped to the floor here, but we have probably about 50,000 individuals on CalFresh currently, and we estimate that there are probably about another 49 or so thousand that could be on CalFresh. So if we could, bump it up by 9,000, that would be, 20% of what we think is the gap right now. So that was the identified population, as I said, and then you can also see from the slide that the other big group of people that we wanted to really target was, and I'm not going to talk about this today, but is also students. We have thousands of students who are signed up and participating in the school meal program in San Francisco, and so are presumptively income eligible for CalFresh, but are not receiving, but their families are not receiving CalFresh, and so. We know in both cases, we know who these people are. We know where, we know something about them, and it's inreach instead of outreach, and makes the job that much easier. We can go to the next slide. Next slide. Hello.
I believe the next slide's up.
Oh, okay, great, thank you. So what we did next is we, as I said, made a proposal to the Board of Supervisors for investing in this inReach, and we actually were successful thus far. There were, between the supplemental budget, which happened during the 13-14 year, and then the proposed budget, which is currently in process, and so it's not a done deal yet. There right now is $2.1 million slotted to increase outreach, the outreach workers in the HSA in San Francisco. And what that will mean is that there will be 2 teams of 8 eligibility workers and 1 supervisor each. So 18 new people that will be dedicated to reaching these groups that, as I said, we've identified, and we know how to get to them. And this is a really exciting turn of events. We actually haven't had a dedicated outreach staff in about, I think it's about 10 years, and this is going to go a long way to having that eligibility staff available to process the applications that some of our CBOs are generating, and just be able to be more of a crack team that can get out into the community and do the type of outreach that we really need to do. As well, we are currently in process, as I said, the budget is in process right now, of having requested a little under $200,000 in additional funding to help support the CBOs that actually go out into the community into sort of the harder to reach populations and really do that application assistance and some of that outreach where a trusted community partner is better suited to do that work. And that right now is going to mean that for us we're going to be able to reach these populations. Of course it'll take a little time to hire the staff and train them up, but it means that we're going to be able to reach these targeted populations much more thoroughly and much more quickly than we would have been previously. And so I think the moral of the story in San Francisco is that using the data and really focusing on the numbers and being able to present a compelling case for these. We're not talking about kind of billboards here. We're talking about these are people who are already involved with another program at some point, and we can reach them more easily. We can reach them more inexpensively, and they're already in the system, if you will, and that's a really great value proposition for city leaders. That's it.
Thank you, Terry, and all the county advocates. At this point, I want to run through a couple of resources and answer questions that we've received, and encourage you to send more questions if you have anything else you'd like us to be sure and cover. Wanted to let you know, there's the link again to the toolkit, and that will include everything, including that we mentioned earlier, but also this PowerPoint and a recording of this webinar will be posted shortly. And then there is the link to the data dashboard. Bookmark that now. That's where you'll find all those charts, and really we just scratched the surface today. So that's that link. I also wanted to share with you all the emails of everyone who's presented today. Please follow up. Again, we're only going to have success statewide if we have the state and county partnership sharing information and sharing strategies. And of course, before we get to Q&A, another plug for the next 2 webinars we'll be doing to share toolkits and strategies on reducing churn and providing same-day service. So for the questions, a couple that have come in so far. One person, Irene, thank you, has said, in her experience, the online Covered California application doesn't ask if the client wants additional info for CalFresh and CalWorks, only the paper app. And I have to say, this issue has just come up on the state side. Well, so Irene, I don't have a definitive answer for you, but it is on our list. We're following up with DHCS now. We won that. It was a hard-fought battle to get that referral on the paper app. And I have to say, I think we believed it was built into the web application, but we are starting to hear that it may not be. So we will follow up and check on that to make sure, because, again, every door should have that connection. So thank you for flagging it on the county side, because that's what we're hearing on the state side, too. A second question that we're going to have Alexis Fernandez speak to is, the short question is, when does the 200% FPL, the new gross income test for CalFresh, go into effect? The budget was signed Thursday, so I guess that means it goes into effect now in terms of counties who want to get ahead of it. But of course, CDSS will likely be working on guidance. So our expert on this issue is Alexis Fernandez at CFPA. So Alexis, can you speak to that, please?
Yes. So the new gross income test of 200% for all CalFresh households goes into effect starting July 1st, 2014. And as Kim mentioned, there'll be a little bit of lag time getting out guidance from the state down to the counties, and then each county taking that guidance and interpreting it at the county level. I do want to clarify that for households with at least one member who's a Medi-Cal recipient, the gross income test of 200% has been in effect since January 1 of 2014. So it's a bit of a rollout, but there are those 2 populations, and you can find out more information about the change on the front page of our website, cfpa.net.
Thank you, Alexis.
Mm-hmm.
We're having a few more questions roll in. Bear with us. And then there's a question that says, is it on? Okay. Oh, wait. A question about Alexis's website, which I don't know. Okay, great. And lots of questions coming in about gross eligibility, so we are going to send them all to cfpa.net and to Alexis Fernandez directly. Hot topic. And I think that's all we have. So happy. Oh,
Will if counties are tracking applications that were denied for being over?
Oh, wow, great question.
But are under 200, and will any of these people be?
I do not know. This is a great question from Francesca Costa. Asked, is there going to be any, I guess you'd call it in-reach, to people who were denied CalFresh for being between 135 and 200 of growth, so they were not, and didn't have a Medi-Cal person perhaps. So perhaps they were denied, but they now would be eligible to come back. Alexis, do you want to take that one too, please?
Yes. So that is definitely a recommended best practice. Most counties can look through their case records and find households that were denied for over income. And so you could look into identifying those households that have previously been denied for over income and reaching out to them because they could potentially be eligible now. I know that some of our partners who do outreach are already thinking about going through their files from their outreach in the past to find households that might now be eligible. So that would be a recommended best practice.
And Alexis, I'm going to put you on the spot and say that you're going to write a blog post for our site, One Stop on Health and Nutrition, about all these changes that tells people, again, what's happening and all the different strategies to promote and to go back to really leverage it for families. So I'm going to sign you up, volunteer you.
Yes.
And that gives me a chance to volunteer somebody else to do the same thing. I know that Jeannie Hayward in Calaveras County is doing some interesting things with combined outreach, and we definitely want to encourage the outreach strategy, and we also want to encourage rural counties who don't have the numbers that LA does, or even in San Francisco, that there's huge opportunities here too. So Jeannie, I'll work with Jeannie to post something about ideas from Calaveras County as well. So keep checking back to the blog for the latest information, not just the data, but the strategies and success stories. And with that, I think we have a wrap. Thank you again for all your time and attention. We hope you'll come back for the next webinars in the series. And please do feel free to reach out with any feedback, evaluation, or lingering questions. Thanks so much.